Why would a man ever want to be a gynae? Right, Brendan?
I wanted to do obs and gynae. I wanted to be a gynecologist.
What happened?
So, in the gym, and I see, women tend to work just lower body.
Yeah.
Squats, all these dumbbells.
So
squats.
for men in the gym, if they see women doing those exercises, is it more preferable to coitally to whatever? It's
My name is Suhail Essa.
Dr. Ntlantla Vilakazi.
Dr. Brendan Matthews.
Dr. Naseem Sharif.
And this is the Gentleman's Clinic Podcast.
Good day and welcome to another episode of the Gents Clinic Podcast. 6 South African male medical doctors on a mission to change the way in which we perceive men's healthcare. Yeah, it's the Gents Clinic. We are specialists in restoring male confidence. Gathered here in the studio today, we have 2 lovely new guests that I would like for them to introduce themselves. So, starting with our lovely lady, the first, the only so far lady that has ever been a guest on this podcast, Dr. B. How are you doing?
I'm all right, thanks. How are you?
Good. Tell us a little bit about yourself. Look into the camera. I thought it would be a bit boring if I introduce you. So I want you to sell yourself to the camera. I mean, not like that, but
I am Dr. B Sumbulo. I go by the name of Dr. B. I'm a general practitioner based in Johannesburg, South Africa. I'm a mom. I'm a daughter. And I absolutely love what I do. I've always known from a very young age that I want to be a GP, actually. And I'm content. Dr. B from the Healthcare Hive. Honey for your soul.
Thank you, Dr. B. Next in the studio, we've got our esteemed guest who is a gynecologist, and he is going to introduce himself. So tell us, Dr. Kwa-Asante, a little bit about yourself.
Yes, so my name is Dr. Kofi Kwa-Asante. I am a specialist obstetrician and gynecologist, currently practicing at Fourways in Johannesburg. I graduated from the University of Pretoria with all my undergrad and postgraduate degrees. I love obstetrics and gynecology. It really is everything that I am. I love the aspects of childbirth and delivery, as well as the aspects related to women's health and women's care. So much so that I've actually written 2 books on the topics that pertain to my area of specialty. And yeah, I think we'll probably get into that a bit later. But yes, happy to be here. And yes, let's go.
Thank you. I think it's interesting that our 2 guests actually studied together.
Yeah.
That's what's up.
Yeah, you guys both from the University Tux of Nix.
Yes.
The most useless university in the country.
Wow.
Same class.
The ones that we rejected so that we could go to the best university in the country.
Which is what again?
The University of the Witwatersrand. Thank you. You can dream.
Wow.
No, I'm just kidding. And I think very interestingly, how we were introduced to you, Dr. Kofi, is you actually delivered Nhlanhla's twins.
100%.
Did you pull them out, or did they pull you? One of them bit the umbilical cord of himself.
50-50 thing, eh?
He came out doing pull-ups.
100%, eh? Yeah.
That's what people are asking. Who had to carry these people?
Please, can you tell us a little bit about that?
Yeah, so I mean, I've known Ntlantla and Sidi for quite some time, even long before their pregnancy. Very lovely couple. So I mean, I was very, very excited when they came to me. I remember the first day they walked in to say that they're pregnant, and then to find out that it's twins.
Yeah.
For me, it was like, wow. I don't think there was
something else.
any couple that was more deserving than they were.
Yeah.
Oh, wow.
Amazing.
It was really a good experience.
Awesome.
My wife will be so happy. but genuinely, we were really excited. And I mean, even just the whole experience we had. I mean, when you guys said gynae, I had no doubt that, I was treated, or my wife was, actually both of us were treated by the best gynae in Joburg. I mean, professional in all levels. I mean, till the last minute. I mean, till now. My wife keeps on throwing his name around every now and then. She's thinking of a third born. You know?
That's what I was going to ask.
Visiting,
There we
Dr.
go.
Kofi. I'm like, yeah. I don't want to hear that guy's name in this house.
It's too soon.
Too
soon. Okay, no, but that's great. That's great. I think the conversation we want to have today is a little bit about female health. You know, we do specialize in male reproductive health, testosterone replacement therapy, erectile dysfunction, premature ejaculation, things that bring men pleasure and restore their confidence. But I think it's important to find out what the other half has to say about all these topics and how you guys have been managing them, how you treat their conditions. So firstly, Dr. B, maybe you want to tell us a little bit about why you feel you are suited and prefer your chosen field of speciality, which is general practice. Why did you pursue it?
I think when I was in medical school, I really enjoyed family medicine. It spoke to me. It was my favorite rotation. During internship, there wasn't one discipline or speciality that I really enjoyed or fell in love with. And it was actually not a nice experience for me. Because everyone expects you to pick something, especially when you know, towards the end of your community service, now you're expected to pick something. What do you want? For myself, I was then placed into anesthesiology. I was a medical officer in anesthesia for about 3 years. And I really did not like the experience. I didn't enjoy it at all. Primarily because there was not much patient interaction. You put the patient to sleep and it's you and the machine and you wake them up. They don't remember you. They know nothing about you. They never see you again most of the time. With general practice, we get to grow together. It's a journey. We heal together. I get to know you better. I get to know your family better. And I get to teach. I get to teach my patients about medicine. I help you to understand your body better, how it functions, the do's and don'ts. And a lot of general practice is about listening. Most of my patients don't have a physical illness. They need someone to listen to them, someone to hear them. That speaks to me 100%.
Can I just take a guess and say that you like myself, like to talk?
I do. I really, really do. You know, when you ask your patient that one question, how are things at home? And they completely fall apart. And you sit next to them, then you get to hold their hand.
Yes.
Let's talk about it. They walk out feeling so much lighter. There's not a drug involved there. There's no physio. There's no specialist referral. It feels good for me and the patient.
So when they like to question me about what I do, I tell them as a family physician, I can do everything that you guys do.
100%.
So yeah, I don't want to be tempted to add on what she's saying now because I'm doing family medicine. So, but thank you for that, Dr.
Yeah,
B.
the holistic care. Just interestingly, because we mentioned how we had actually met Dr. Kofi and the relationship that we have through Nhlanhla.
Because I think we have some industry or game changers here at the table, because the review that you gave, the introduction that our gynae gave, was the same as what she's describing, and you're a specialist obstetrician and gynecologist. You know, so at the surface already, it looks like he's treated you so well that he's treated you as people, as human beings, you know, and not just as another lady who's pregnant with twins and oh my God, it's a high risk multiple pregnancy. I need to get this out, you know.
Exactly.
So so I'm happy that we've actually got the two of you.
And that leads us towards our next question, Dr. Kofi.
Yes.
So, you know, as men, Brendan, you were saying this, you know, as in medical school, and I suppose for a lot of the lay people,
100%.
they often look at us and go like, why would a man ever want to be a gynae? Right, Brendan? What was your thoughts on that?
So, firstly, men never visit a gynae. We don't go to a gynecologist.
100%.
But we have so much of questions about what does a gynae do? What does he see there? And so
What is he
forth,
doing
you know?
there?
What does he interact? What are the things he finds?
And
So
then
that's
how
what-
does he go home?
Yes,
And
and
have
still
a
interact.
And have a
normal-
relationship.
a relationship.
Yeah.
No,
So I think
definitely.
at a medical level, we would understand. that, you in a different mindset.
100%.
Yeah.
100%.
It's medical.
It's not. No, but I remember we actually once had this chat at varsity when, we were obviously very interested in the study of the female genitalia.
As young men.
We were quite exceptional.
Yeah, the theory and
in
the practical.
both course and intercourse.
Of course. Oh, wow.
Wow.
Love it.
So
That was my question. No, sorry.
Yeah. So I remember you once asked me that, Lida, you seem to be very good academically in the study. And, the other study.
Mm-hmm.
So why not just focus entirely on gynecology,
Yeah. So I wanted to do obs and gyne. I wanted to be a gynecologist. I was looking at our yearbook. And I wrote there, in 10 years, I'm going to be a specialist gynecologist.
What happened?
No, I actually started realizing that, like in Nhlanhla says, like at school, you go to school, you're doing gynae, it's kuku, you're reading about kuku.
Yeah, 100%.
You go home, weekend, go with friends, it's kuku, intercourse.
Yeah.
Now I thought work as well. Now I'm just going to be a kuku man.
Everywhere you go.
I know.
Everywhere you go.
Couldn't be just kuku my whole life. So what is it that actually now?
Yeah, I think Dr. Kofi, we've spoken enough.
Yeah. Sorry.
I think we've spoken enough. You tell us, what was it for you that really drove you towards gynecology?
Yes, I think Nhlanhla touched on it briefly to say, look, there's a firm divide between work and outside of work, basically. Okay. But to take you back to when I was in medical school, the way I actually got into obs and gynae is, it was actually my worst subject in medical school, believe it or not.
Why?
It was actually my worst subject. So what happens is, and Dr. B will attest to this, in Turks, what happens is you have 3 exams.
Yep.
You have the block exam, you have the first exam, and then you have the re-exam. So the re-exam is that exam that if you don't pass, you're literally going to repeat the year, right?
Sure.
So it got to, in obstetrics and gynecology, I got to the re-exam. Right. So I was that guy. Look, I was like, I'm going to have a balanced life. I'm going to enjoy my varsity days and I'm going to still try and maintain that academic, aspect of it as well. So obs and gynae took me to the re-exam. But now remember, when you get to the re-exam, you have to be serious now. Now 100%. It's like, it's do or die. You don't want to be that guy that comes back the following year and you're there with the juniors and that kind of stuff. So to pass a re-exam, in retrospect, based on what I did, you have to know the subject so well. And it goes beyond just knowing the theory of it. You have to actually fall in love with this thing to actually have an understanding beyond just an exam paper, right? And I felt like the obs and gynae paper preparation took me there because I felt like I have to do something here that I've never done before. I need to fall in love with this thing. I need to understand this thing and I need to make it a part of me. And in that process, obs and gynae became my best mark. Wow. From literally my worst to my best.
Can I quickly just interject, because it seems like you have still a lot more to say. But the re-exam,
right?
Do you do the first exam and second exam? If you don't do well enough, then you come back for the
re-exam.
100%.
Okay. So there's a baseline that you need to meet, like a percentage. If you don't get that, you get shoved onto the next exam.
I see.
And the next, so they're giving you you have 3 opportunities. Extra chance. So by the time you get to the re-exam, it's like, you've been playing around, hey? Now you need to get serious. And I won't lie, I was that guy. She'll testify. I was that guy who was just I was doing house committees. I was doing serenade and seri in Turks. I was that guy who's just I was the chairman of my house committee at one point in my final year. I was the chairman of my house committee. So I was like, no, I'm going to do this varsity thing to the max so that when I leave, I know that I did everything the way I wanted. Because now looking back, my varsity years were actually my best years.
Man.
You know what I mean? Those were my best years. And I look back with no regret. So that's how I actually fell in love with obstetrics and gynecology. And I've never looked back ever since.
Awesome. And then to touch on what we were speaking about, they had their opinions. I'll give you the metaphor that always has stuck into my mind. Someone once asked me, so tell me, if you work in a sweet factory every single day, the first thing you do when you go home is not want to have a sweet.
All right, yes.
So tell me, you spoke about the mental and the work divide.
Yes.
The divide. How do you manage that divide in your mind?
Look, obstetrics and gynecology is a very stressful environment. It's a very stressful profession. I think that's why a lot of medical professionals steer away from it.
Yes.
Because the hours are crazy. And also, you don't have time to think of it in any other way other than We need to get in, do the job, and get out.
Yeah.
You don't have time to sit there and fantasize and be like, ooh, actually, yo. You know what I mean? Ooh, actually. No, when you're in there, you are literally, you want to get in, help this person, and get out. And you're not looking from a point of view of pleasure or from a sexual point of view.
Sure.
You're looking from a point of view of, there's something wrong here. And I need to be the one that finds out what that is and fix it.
Yeah.
Right.
I think you know, one of the things that I found in my life, like older men would come to me at the braai. People in my family would be like, "Hey, you must specialize. You must become a gynecologist." And I was always like, "Bruh, do you think they bring us the nice ones?"
That's a good point. Can I actually ask something on that?
Yes.
And before I ask my question, I want to maybe give some context so it doesn't seem like I'm just clowning or whatever. So I teach undergrad students, final year primary healthcare students. And maybe this is a concept that's not well understood and people might not understand it, but because of the history of our country, how our social society is set up, and the past and our minds as society, there's sort of like maybe an unconscious sort of hesitancy when you, or not even hesitancy maybe, when you meet people across racial lines in the hospital. So we train at Wits specifically, and maybe across the country, with largely lower socioeconomic and black population, and that's who you're treating in your government and clinics and sort of. Yes. And then you'll find people like even fellow doctors will be like, I don't want to go work in the suburbs. They have white people. No, I don't want to see white people. You know, you might, I don't know, is it intimidation or what is it that it is, you know, that you feel sort of, I mean, it's a patient across the table, but because they're white and they ask you extra questions, now you sort of want to back off from that, you know. So my question is really, and this is probably what people who know you or see your social media, don't know you, see your social media, and they say, this man is treating celebs, man. Celebs walking into his office, I'm not into it. Serious, and, you know, white people.
100%,
you know,
100%.
So people out there might ask, you might think,
yes,
you know, but there's that divide that you talk about. You know? So I think it's important, even for doctors, to understand, was that anything you encountered that the first time a celeb or person of a higher socioeconomic class sat in the lithotomy position in front of you? Was it something that, you know? Yeah, it's
maybe a more general question on, like, you know, public, private.
Yes, I think that's a simple to put it. Yeah, your transition.
And then I think, Dr. B, you can also touch on that. Yeah, the public-private kind of difference in patients and your interactions.
I think when a lot of celebs come to you, you know how it is when a celeb comes to you and you don't know who they are.
Oh man,
right?
Oh, that happens a lot.
Because a couple of I'm a guy. When I'm honest, when I say I hardly have time to be in the social scene.
Yes.
Okay. My job does not allow me to. And the little time I have, I want to spend with my kids and my family. You know what I mean?
Of course.
So when a celeb comes in and you don't know who they are, it's a big deal. And I think, in a sense, the celebs that I've met, it has actually helped me in that regard. Because I won't lie. I mean, when you see a celebrity walk in, I don't care who you are in terms of the kind of doctor you are. You will feel like, whoa, okay. Yes. You know, there'll be something that comes over you.
That's what I'm trying to explain.
Right? Yeah. And you still need to maintain that level of calmness and that coolness that will still allow you to execute your professional duties professionally. Right? And that takes some doing. That takes some training. That takes seeing countless number of patients, different interactions, different views and opinions from different patients to actually be able to handle yourself in that situation. Right? And I mean, it can go very pear-shaped very quickly as well. You know, because now you're like, yo, it's a celebrity, yo, autograph, yo, this. But you have to literally bring almost like pull yourself towards yourself and be like, listen,
I'm a professional.
I'm here to do a job. And they need to also see that in you, that this person is not just a groupie. Yes. You know what I mean? Because it's easy to come across, you're a doctor, but you can see that it's, you know, it's a group, and then they also get a tainted idea. You know, they have expectations, they want preferential treatment and all of that. So you need to kill that very quickly. But it does take a bit of time to actually get to that level where you're able to literally put out the flame of expectation from different patients.
I think it's just important as well. as medical doctors, but for gents out there in society, we're not just having fun.
Yeah.
It's work. It's proper.
Yeah, I mean, when
serious
it comes out in
professionalism,
in social circles as to me being a gynecologist, I mean, we have this conversation right here.
Yeah.
It always comes up, yo, you're a gynae, yo, tell me what's up. And then they go on my social media, then, yo, I'm like, guys, it's not like that. This is work, eh? This is literally something that puts food on my table.
So,
And you best believe I'm not going to do anything to ever compromise that.
Exactly.
You know what I mean?
Yeah.
So it's literally a 9 to 5. Well, in my case, it goes beyond 5. But, yes.
Yeah. B, do you have some input on
So I definitely agree with Kofi there. Some of the celebrities, I really don't know them. And, they come in with the shades and the hats, and I really don't want people to see me. And you're like, okay, what's happening? That's the first thing. The second thing is, it's actually to what you were asking about, the sexualized part of gynecology. It's actually interesting for me as a female doctor when I have to treat male-related issues. So I have got sores on my penis and I need to have a look. The number of men that say, look, I'm not ready. Okay. Give me time. Just give me, it's small. So just give me 5 minutes. It's cold. It's gonna come right. It's gonna come together.
Are you serious?
I'm serious.
So what happens in the 5 minutes?
Self-conscious.
They'll try and put together an erection. Just for
you to examine.
Ways.
Put one together like it's a stew.
Take a bit of
No,
this.
guys, this is a public service announcement. Gents, what are you guys doing to our female doctors now? What is
I
way?
get that a lot. Look, I'm not ready.
Yeah.
I didn't come in prepped. So what you see is not really what it is. Just give me a chance. Or look, I can't take it off. I can't take my clothes off. I don't want you to see. I'll tell you what it kind of looks like, or I'll draw it for you. Or I took a picture at home when it was a goodish size, so you can see it. So
but why doesn't such a patient, interject, why doesn't such a patient just go to a male doctor?
Yeah.
You'd think that they'd be more comfortable with you know what I mean?
There's that, and because I work in a group practice, sometimes it happens that there's only female doctors there. So you want to get helped now. And we have to do, digital rectal exams, and then, the erections, and it's something else on the flip side, right? Very, very different.
Different perspective.
Never thought about that.
You kind of have to warn your patient that something like this may happen. If it does happen, it's okay. We'll just proceed.
Look, maybe that guy had recently visited the Gents clinic and he was just trying to show off the medication that he got from our
How well it has worked.
How well he was treated by us.
How do you judge? And is it maybe a personal feeling? How do you judge when this is now borderline harassment, inappropriate?
Someone that wants to get helped is not concerned about size and what's happening. I just want to get, please, just have a look. They're very sincere. Someone else would be like, hey, so what's up? There'll all be all these other innuendos and hints, and that's when you have to, very, very quickly, try and address the issue. Look, I'm your doctor. And there have been a few times, once or twice, where I've had to say to a patient, I don't feel very comfortable treating you. There are other male doctors in the vicinity. I'd like to refer you to a colleague.
100%.
Yeah. And I think it's good to, develop those
Get a perspective as well.
personal boundaries for yourself.
You have to. You absolutely have to. Because guys do not hold back.
They don't. They don't.
So just conversely, do you feel that? Do you get that?
I mean, I've had to chase some patients out of my practice.
Oh, really?
Just
Wow.
because of unprofessional conduct from their side.
Yeah, I can.
It's not something I like to do.
Yeah.
It's not something I like to do, but I feel like the minute that line becomes blurry,
Sure.
no, it has
I
to
think
end.
have none of us experienced? I mean, I have, but for
I've
me,
never.
it's like now very inappropriate because you're sitting there in the antenatal clinic line.
Yeah.
The abdomen is big. I mean, there's obviously a man involved.
There's obviously
because
some
the man
coitus,
put the baby there.
100%.
How are you not engaging me as the doctor, as a working
But I
doctor?
think it also speaks to the fact that when you are pregnant as a woman, your hormones are literally raging.
That's a question we had for you.
It's raging.
Tell us more. Because actually we are prepared to, we really were wondering, we were really asking. Nhlanhla, do you want to ask?
So the question was about that. Is libido increased in ladies during pregnancy?
100%. Remember, there's a lot of things that are increased during pregnancy. The first thing is blood supply. Right?
yes.
And it's blood supply where? To the critical areas.
Okay.
Right? Because that's where it's all happening.
Yeah.
Right?
Uh-huh.
Hormones have increased because all of this is in preparation for what is about to happen, which is the pregnancy.
Yeah.
But lo and behold, there's also other things that also respond very well to increased blood supply and increased hormones. And that's your libido and your sex drive.
Yeah.
Right?
Yeah,
So
I
pregnant
see.
women, oof,
Now, Doc, there's this question, man.
yeah.
In pregnancy, right? I've heard, man, that intrapartum coitus.
100%.
Yo,
Tell me about it.
Apparently, it's like the best you could
Smacks.
ever. It smacks from a guy's point of view, you know. And then postpartum coitus as well, you know. Hey, these are
postpartum with the scarring. Do you wanna-
Explain that one?
So
Is it
look,
scarring or-
intrapartum actually means delivery. We're talking antenatal.
I mean, sorry, antenatal.
So antenatal
Because
coitus.
that's now weird now.
Like, that's actually what I was thinking. Why are you?
Intrapartum means a baby's trying to come out. You're trying to go in.
They're trying to put it back in.
It's a one
It's go back.
direction. One direction.
This is a wild podcast. This is the wildest
I think the
episode.
cameraman's about to fall over as well just now.
Okay.
So
Tell us now. Let's get serious.
So there's
Yes,
antenatal,
antenatal.
and there's postpartum, which is
Yeah.
after
Yes.
delivery, right?
Yes.
So antenatal means while she's still pregnant. That's when the hormones are raging, right? And remember, intercourse, like I said, it's a combination of, it's a psychological, it's an emotional, it's a physical, it's a hormonal thing as well. So intercourse during pregnancy, definitely, it is heightened in terms of the feeling and the pleasure associated with it for both men and women, right? The problem with postpartum or after delivery is now this woman has a baby, right? This woman has gone through 9 months or 10 months sometimes of pregnancy.
Yeah.
Her body has changed, right?
Yeah.
So she's not feeling like the most attractive person out there. So the last thing on her mind is intercourse.
Okay.
Mind you, the first thing on the guy's mind is, okay,
also,
listen,
yeah.
'cause
Yeah.
some men would actually abstain from intercourse during pregnancy.
They're
Because they're
missing
like,
out.
right?
I don't know, but I heard.
but it's out of fear, and it's also a bit of misinformation that listen, when they do have intercourse during pregnancy, they can, hurt the baby, and and what is actually a fact is, look, after intercourse during pregnancy, there will be a bit of spotting. That usually happens, and that usually terrifies some men to the point where they're like, yo, never again. You know what I mean? So it puts them off. But look, actually, that is actually the time when it's actually most pleasurable for both the men and the woman. And even if you as a man don't want to, the woman is going to hunt you down. Because these hormones are literally, it's a physiological thing. It's not something that they're necessarily in control of. So the best thing you can do as a man is try to meet them halfway.
Can I just ask, you speak about women who have a long duration of pregnancy, so at 10 months. Would you recommend sex as an induction agent?
100%. I recommend it all the time.
Okay.
Because we're talking sperm. And sperms stimulating prostaglandins, which then encourage cervical ripening, which it essentially becomes labor. So I always advise my patients from about 37 weeks onwards, if you're aiming for a normal delivery, have intercourse. The way you started it is the way you must finish it.
I love it.
That's what I tell them.
The way it starts.
The way you start is the way
You've come full circle.
Yeah.
Literally. So that is actually proven to be a way to actually naturally induce labor. There's artificial ways with medications and prostaglandins, but we try to avoid that unless we absolutely have to.
So I have a question, right? I've heard, this is from gents who've had, the ladies deliver through normal vaginal delivery, like, Dr. Matthews, that apparently postpartum vaginal vestibular scarring, it can be something else, man. Just the stimulation is insane, Contrary to what gents think. They think once the lady has delivered, it's now a gaping wound. No, sorry to describe it like that. But apparently it's the other way around.
Yeah, because remember now, you've delivered this, you've had this baby, and now your blood volume has doubled during the pregnancy.
Yes.
But now there's no more baby. But all this blood volume is still there. So in that 6-week postpartum period, you actually find a lot of people coming back and they're already pregnant.
Yeah.
Why? Because the pleasure is heightened. But the woman, that would be the last thing on the woman's mind, however.
For the first month.
Couple months because
Yeah,
there's a new baby, body shaming, she feels like she's not pretty anymore. But if you do happen to engage in intercourse, definitely.
How long should you wait to have intercourse?
After delivery.
Postpartum.
Well, I guess it also depends on how you delivered. Because obviously if you had a C-section,
Sure.
healing, scar, that kind of stuff, it may take a bit longer. Normal delivery, a bit quick. I mean, in our government clinics, when you deliver a normal vaginal delivery, you're out 6 hours.
100%.
You're gone.
Yeah.
So that's us saying that you're good to go.
Yeah.
But the biggest thing as far as the recovery is concerned is contraception. Because a lot of people will not usually have contraception within that time. Our government clinics are actually doing quite well to either maybe insert the implant before you go. I know we were doing this as interns.
Sure.
Insert the implant or maybe give you the injection before you go.
Yeah.
But I feel like maybe a bit of information is lacking there because I also see a lot of patients who will come back and be like, yeah, they just jabbed me. They just put this thing in my arm and then they'll come back and have all the side effects and not know what exactly is happening. Especially with the injection because now they can't fall pregnant after stopping it.
Yeah.
And then it's a thing of there was just misinformation. But I mean, as far as to answer your question, when can you have intercourse? I think if you're able to have the adequate contraception in place, and I don't mean pull-out method, by the way.
That thing doesn't work.
It doesn't work. So it's a matter of seeing your gynae to see that you have recovered if it's a C-section. But a normal delivery, you can usually get back a bit quickly. I'd say within the first month after a normal delivery.
There was a I can't remember if it was a prof or one consultant said when the placenta's out, available.
I
I'm telling you.
The next one in.
Wow. Yeah.
So from all of this that he's described, we talk as gents,
Sure.
Obviously speaking from a specialist point of view, but as a personal point of view, if you're willing to share anything that maybe contradicts or different experience, if you're comfortable to. You did say your mom, you put that out there.
Well, I will say this. I think my libido was, up there
Okay.
during pregnancy. And I was ready to go after the baby was delivered.
Placenta out.
Yes. Unfortunately, I didn't have a Caesar.
Oh,
So
Yeah,
it took a
okay.
bit longer. But
Yeah.
I share Kofi's sentiments, definitely.
Is it?
Okay.
Is it?
Okay.
Oh, okay. Another one from me, Kofi. I think it's a question I just got from what you were saying, that because of the misinformation or no information post-delivery with the implant or the injection, whatever, you said something about women struggle to fall pregnant.
100%.
Are you saying after the duration of action of that drug, or?
Yes. So when you're counseling someone on contraception, you must always look at the time for return to fertility. Right. And I think that's something that we don't usually include in our counseling sessions. So you want to prevent pregnancy, but what happens when you want to fall pregnant? How long is it going to take you? Because I see a lot of patients who are frustrated, particularly with the injection, because that is known to take the longest. I mean, I've had patients who take 18 months to 2 years after stopping it before they can fall pregnant. Now you can imagine relationships will fall apart because now the guy thinks, it's you, the woman. The woman says, no, it's you, the guy. And then that's how, relationships fall apart. So I think there is a bit of a gap when it comes to counseling, pre-contraceptive counseling, that needs to be filled. And it can cause a lot of frustration for many patients. Eh?
Yeah, I think, look, it's fertility and contraception, it's catch-22 in our society now, government implements good contraceptive measures via primary health care and promote women to sort of choose their path. Contraceptives were started in the 1960s and it saw a huge rise in women now choosing to work and are able to work and choose the lifestyle that they want.
That they want,
But I think let's open the floor to chat a little bit about fertility. And I think currently, as I don't have any stats to support this, but I have heard and have seen and just chatting to other colleagues about the increasing levels of infertility in our society now. Why do you guys think that this has become something, or is it something that you found?
Definitely. I'm seeing more infertile women than I am seeing women that are pregnant.
Sure.
Wow.
That's crazy. It's crazy.
Is this a field of your expertise that you...
Yes, 100%. Because I have colleagues who specialize. So obviously you're a gynae and then you can choose to super specialize in infertility. Those clinics are packed.
Sure.
Those clinics are packed. And I think it's multifactorial. when you talk about infertility, there's not one thing that causes infertility. There's definitely many aspects that contribute. But to pinpoint the one thing and say, yeah, because of this, you're going to be infertile is very hard to do. I think in our society, personally, I think it's because we have a high incidence of sexually transmitted infections. Because remember, that's the one thing that will end up distorting the anatomy of, well, from a female point of view anyway. That will end up distorting the anatomy, where now it decreases the woman's receptivity to sperm. It affects the fallopian tube architecture. It affects the ovarian reserve. All of these factors that would affect a woman's ability to fall pregnant. And obviously, if you have a sexually transmitted infection, the idea is you probably wouldn't want to have sex until you're sorted. So it also puts you off. The libido would be on the ground. You're not trying to actually conceive. But when you do, problems arise, because even after you've treated the primary infection, that's when you actually get what we call the sequelae of an STI. That's where the scarring happens. So once you've healed, you're fine down there, but the damage has actually already been done. You know what I mean? So the idea is, there's a high rise of these infections in our society. I'm talking syphilis, herpes, chlamydia, gonorrhea, the HIV, which that's a big one. All of these, I believe, are contributing to a high incidence of infertility, female infertility anyway, in our society. I don't know how you've seen it, Dr. B.
Yeah, I see a lot of infertility. And a few of my patients have brought this complaint across. My partner and I have been trying for the last 2 years.
Yes.
And my gynae says it's fine. Just keep trying. It's still early, especially if it's a woman under the age of 30. You still got time. It's okay. Relax.
100%.
How, or rather, when should a couple start to panic?
I think when it worries them. So it's very hard to put a timeline to it. I mean, when we're taught, we're like, 6 months of trying 3 to 4 times of intercourse per week, unprotected intercourse.
Sure.
And if you're not pregnant, something is wrong. But that is textbook. And I've learned in private practice, nothing is textbook.
Oh, yeah.
Nothing is textbook. You learn new things every day. So what I tell my patients is, look, when you guys start trying, if you get to a point where you're worried that it's taken too long, come through. Be that 2 months, be that 3 months, be that 4 months, so long as you can tell me that you've been off contraceptive for the period, the required time, and you've been actually having intercourse as prescribed, and you have normal menstrual cycle, or as far as the woman is concerned. So if you don't have that, we need to find out why it is you don't have a normal menstrual cycle. Obviously, that ties in with ovulation. Are you actually releasing these eggs at all or not? And if you are ovulating, what's happening with the fallopian tubes? What's happening with the architecture of your uterus? Can it actually hold a pregnancy? But you'll find in society, like I mentioned, all these tests that you can do for a woman, but with a man, you only need to do one test. One test, right?
Yep.
But we'll go through all these tests, spend all the money, and find out that actually the woman is fine. You know? And then eventually we come to the man and you're like, oh, okay. So you're the problem. And then it opens up a can of worms, because now the man is like, no.
It really does. I find
it me. And some of them actually refuse to do the test.
They do.
And interesting enough, Doc, now that you say that, stats-wise, these are evidence-based. Infertility between men and women is actually 30%. It's equal.
100%.
So I mean, like you're saying, I mean, we're actually spending quite a lot investigating solely women, right? When we could just do one test for gents and get 50% of the problem out,
sorted,
and then see what's going on.
One of my profs says, I mean, the first test you do in infertility is you come in as a couple, you do a sperm test. That opens the gateway for other tests in the event that is negative. Or there's a problem there.
Really interesting.
Sorry.
No, I just wanted to ask. I mean, you spoke about infertility. We spoke about STIs, and I mean, just looking at what you guys were saying and the ping ponging there, it seems to be this picture that you guys are painting, that people like STIs are kind of increasing, and HIV is probably also increasing. 100%. Are you guys seeing a pattern where you're finding that people are struggling with these conditions more lately? I did present a study last time, but it was based on a rural area in KZN, and and in that particular study, they were reporting that, I mean, they were finding that especially certain pathogens, like like chlamydia, for example, was just going out of control in those places. Are you guys seeing that? Are people
I don't know. Sorry, I must say, since I made the transition from public to private practice, I don't know where HIV has gone.
Yeah.
I see very little HIV in private. And when I do see it, the patients are very well controlled. They're just there for their repeats, no issues. I'm not sure
Dr.
what's the
Matthews,
contributing factor there.
Can add on?
When it comes to HIV,
Yeah.
I was going to ask a different question, but I think there's a lot of psychological, socio-economical issues that result in the HIV prevalence or incidence being so high in public as it is to private. It's poverty, it's drug use, it's poor education, it's access to healthcare. It's when you get to the healthcare and the education there, you get there and you find a young lady, white lady who doesn't understand Zulu, and everything that she says in English, the guy is just saying yes, yes, yes. So there are a lot of issues that create that divide, But the management is the same. I would even go as far, private is excellent, but the resources we have available in private for HIV are first class in the world.
You mean government?
In government, in government. So it's just that we struggle with those non-medical issues. So I think that's why.
Okay.
But I also think the stigma for HIV has died down a bit.
It really has.
Yeah.
Like
really
no one
has.
fears HIV.
You were telling us a study recently.
Yeah, the study that alludes to the fact that condom usage is actually on the decline in our society. And that's due to what they found is that with the invention of these new HIV drugs, people are actually lessening the use of condoms because they have these drugs as a protective measure against these sexually transmitted infections, which is actually quite shocking.
Against HIV, but they're still going to get the chlamydia.
That's
going to make them infertile.
That's the problem.
You see. So I wanted to ask, asymptomatic chlamydia or gonorrhea infection, does it also contribute to infertility? Because I think ACOG, which is American Society, they want every woman over the age of 21 should be screened for chlamydia with the NAAT. I think I was reading something like that. Why do they do that? Is it because does asymptomatic STI cause infertility?
It depends. It's very hard to say that an asymptomatic STI would result in infertility because for you to have an STI, it's the classical symptoms of itching, vaginal discharge, and sometimes even lesions, depending on the type of STI that we're talking about. And it's only when you have that acute phase infection that you actually get the chronic phase thereafter. So it's very hard, the inflammation and the scarring that actually ensues thereafter. So it's very hard to say, if you have asymptomatic chlamydia, that you'd probably be prone to the infertile aspects or that results.
So I asked that because there is a lot of asymptomatic STIs. Someone, we always used to say, I don't like, we always used to say, we used to say that you look first before I go down there. But looking, actually, we found,
it's actually the weakest. It's the weakest mode of knowing what's going on.
But to touch on that as well, we're asking women to go for their pap smears on an annual basis.
Yes.
Right? And one of the things that we can pick up with the pap smear is chlamydia.
Okay.
Right. So if you as a woman are taking care of your health in that regard, a pap smear, HPV is asymptomatic.
100%.
Right. But the minute you have it and it progresses, we're talking cervical cancer. That is really, really serious. So in you going for your annual checkup, we should be able to pick up these asymptomatic STIs that can cause problems in the future.
Sorry, just to digress a little bit. What I've also picked up with my patients is that there's a lot more secondary infertility as well.
Yes.
Just to put it back to you, Kofi, what do you think is the cause of that?
Causes of secondary infertility.
Yeah, I'm seeing a lot of it. It's quite crazy.
It could still be.
Is
could still be the
could
infections.
It could still be
the scarring.
Look, the causes of infertility are the same. It hasn't changed essentially over time. So what I would think would be the times that we live in now. Like I said, there's a lot more promiscuity in our society.
Oh yeah.
Right. The whole thing about decreased condom usage as well. And also, one thing that we don't mention is surgery, post-surgical scarring. I'm always of the opinion that the minute you enter a woman's pelvis, there's some degree of her fertility that you take away. Not that you do it intentionally, but invariably whatever you're doing in there has to heal.
Yeah.
Whether you touch the ovaries or the fallopian tube or the uterus, there's some scarring that's going to form over that area. And that scarring has the ability to distort that anatomy the same way an STI would.
Yeah.
Right. So adhesions, definitely. I think we're doing more surgeries these days.
Oh,
Some
yes.
necessary,
Yes.
some unnecessary. That's another debate.
Yeah.
Yes.
But I think that is also contributing the overuse or the performing of unnecessary surgeries. I mean, especially when it comes to C-sections. I mean, that's the biggest one as far as my profession is concerned.
Yes.
Yeah.
I mean, in private practice, the C-section stats are through the roof.
Yeah.
In government, there's a bit more, when your prof comes in the morning and you did 6 C-sections, they'll be like, hey, why did you do C-sections?
Yes,
And what were the
why?
indications? And I'm like, yeah, it's hot here. So in government, you're kind of trained to actually go the normal route as much as possible, which I personally believe is the right way to go because it's much better for the patient, to be honest. The recovery, the less comorbid conditions, it's unmatched compared to a C-section. I mean, there is a place and a time for a C-section, I believe, but let's use it then. But these days in private, we're doing it as cosmetic surgery, really.
Jeez.
We are.
It's crazy.
Get admitted, and the nurse asks, "Are you having a C-section? Are you booking for normal?"
Yes.
Exactly. Yeah, that's what happens now. That's what
Right.
happens now.
And I mean, do you get patients that'll just come in and say, "Hey, doc, I'm pregnant and I came to you because I want to have a C-section."
100%. Patients will actually come and tell you.
And you just counsel them and say, "Well, look, if that's your choice, we can go for it.
Yes.
But I'm gonna advise
I'll counsel you, but I'll definitely add my 2 cents.
Mm.
I'll definitely add my professional opinion as to why I think it may not be the right choice for you, especially if you don't have an indication. Look, granted, you saying you want a C-section is an indication. We call it C-section on patient request. It's perfectly an indication, and you'll sign for it and we'll still do it. But I feel like I have an obligation to you as a patient to let you know what exactly it entails.
Exactly, yeah. Which I'm sure. Sorry to cut you there. I'm sure a lot of women don't know about this. You just think, natural C-section. My doctor will just do it if they have to. I mean, most of the time, I'm sure you have to. But I don't think people actually have the depth of knowledge to understand what you're causing to your anatomy.
Yeah.
Yes.
Besides the scar, I mean, people only care about the scar. Yeah.
Yes.
And I mean, just from personal experience, my wife's scar is this small. It's actually nothing you should care about. But the anatomy and all that stuff. I mean, that's probably
Don't know
something
what's going on
you
inside.
should consider. Yeah.
Before we leave the STIs, there's something I just wanted to call gents out there to order on. I don't know if you guys have come across it, but when we come to warts are sexually transmitted,
100%.
right? And a lot of women, I mean, there's lots of stories.
I've got one.
Just touch on one, please.
I want to hear yours.
Yeah,
But
tell us.
I won't tell a story because there's too many. But
Yes.
basically, men, why is it that you tell your woman not to remove the warts?
That's
That is
crazy.
entire with my story.
Yeah. They say that, so I'll just say what one guy said to me, that it feels like grapes. They're inside.
No,
Joys.
man, those
I'm
things
telling you.
smell,
I've had
man.
the same thing at Kalafong Hospital.
Yes.
I was, I think I was in my third year of registrarship. Lady comes, dude, the worst words I've ever seen.
Yeah.
I mean,
Yeah, genital warts or
Fungating
something
out.
else.
Yes.
outside. I mean, almost to
Yeah.
the knee.
Guys,
type
Google
thing.
genital warts.
Right.
You'll see what we mean.
And then literally, my inclination is, okay, we got to do something. And I mean, it's not something that it's going to be easy to do. Because, I mean, you're going to have scarring.
Yeah.
And
And she's coming for help.
she's coming for help, but
Yeah.
she's not coming for the kind of help I want to give her.
Ah,
You know what I mean?
Yeah.
Because I see that, I'm like, okay, this has got to go. And he's like, no, doctor, you can't touch that. You can't touch that. I'm like, can't touch that? Why? What's wrong? No, husband, he like it during the intercourse. You feel nice for him. I'm like, so that ties in with what you're
man.
saying, that some
Yes,
men are
man.
actually having this, I don't know if it's a false sense, I can't attest to it, to be honest, but there's this sense that genital warts increases sexual pleasure.
I mean,
And they smell,
I don't
man.
understand
And the
it.
smell.
The
The
smell.
is unbearable.
smell.
The smell's horrendous.
Yeah, but
I think the worst one I heard was at Bara when they discharged the patient after the debulking procedure. So
Yes.
they removed the warts
Yes.
of the vagina. The husband came back with the wife saying, Buyisa izinto zami. Buyisa ni izinto zami. Bring my things back.
That is just wrong.
You see?
That
No,
is
turn off from
crazy.
No, so number one, the wife's own autonomy.
yes.
That's an issue
comes into
of
play.
discussion, you know. the man is still dominant. It's a big issue around sexual,
Sure.
Power and
sexual
society.
powers and all of that, especially South Africa. But gents, order.
Order.
I'm calling you guys to order now. What's the
Wow.
issue with the wards, man?
yeah, those things have to go,
Aye,
man.
aye.
Yeah.
No
I wish
way.
we
No,
could get
that's
someone
crazy.
to like comment on that. Someone who
Actually
actually,
Yes,
enjoys.
you know what I
nice,
mean?
man.
Because
Well, I mean, people can leave their comments and let us know.
Anonymously.
But, yeah,
Anonymously.
we've got about 20 minutes left in the
Yeah.
podcast, so I want to
Right.
get through the last couple of questions.
Right.
We were talking about fertility. There's a few things that I want to ask both of you guys. So
Yeah.
I'll open the floor up for both of you to talk about. Just general, firstly, the first tip I think we got from you is that men, get yourself tested first. Okay. We help men when they are having problems having intercourse
Yeah.
and getting it up or lasting, but we don't really push enough that men need to also come to look for help when they're not able to conceive, instead of pushing the problem onto their partner
Yeah.
and thinking that that's an issue. And that's one tip. In terms of other tips that you can give, the first one I want to just ask, because this is maybe a myth that has been brought forward to us. So you can answer the question and then tell us what you would advise. But one of the things that I was told by a patient is that he heard that certain sexual positions, one, can improve fertility, your chances of getting pregnant. So like doggy style versus cowgirl, because cowgirl,
gravity.
the woman is on top, and so the gravity
Works
causes
against you.
gravity is working against you. Because of the angle of the uterus during doggy style, you can actually improve your chances because the conduit is in the right direction for your sperm to get to the eggs. So is this true? And also, is there any specific position that you can use to determine the gender or to improve your chances of a specific gender?
So can I say with the gender thing, I got told if you shoot to the left, you get a boy. You shoot to the right.
There are many
How do you move left, right?
when you're in there, you're in there.
Eat yogurt if you want a baby girl.
Hey, all of them. You see.
Look, obviously, none of these have been scientifically proven as far as the gender is concerned.
Sure.
But look, there is some merit to the sexual positions. In terms of
okay.
Doggy style, or we call it the rear entry position.
The rear entry.
The relationship, you guys.
From now on, guys,
lose this
no
doggy
rear
nonsense.
entry.
Ambiguity now.
Yeah, we are not
Yeah.
dogs.
Of rear entrance. There's no
Yeah.
ambiguity of rear entrance.
Whoa. I'm a guy. So yes, it does alter the anatomy somewhat, which would make it more favorable. Because remember, when you ejaculate as a man, your sperm has certain characteristics, and one is that it has to travel distance to get to its destination.
Yes.
So obviously, if you shorten that distance by changing your sexual position,
Okay.
you stand a better chance of conceiving.
Yeah.
The missionary position is another one. So those are the two that would usually, facilitate that fertility happen quicker.
So we teach patients who are trying at primary level
Yeah.
that they should stay in missionary, put a pillow
Pillow,
under the
100%.
pelvis and sort of tilt and stay there for like 10
After
minutes.
intercourse,
Yeah.
100%.
B,
100%.
any advice? Anything that you tell your patients?
No, not really. I just wanted to ask something a bit different. A lot of men assume that their machinery works. Is it advisable for a gent at any given time, not necessarily if they're trying for a baby, is it advisable for them to do a sperm test? Just to see that the boys are swimming.
Outside
The
of
boys are here.
wanting a baby or
Yes.
for fertility. I don't know. I would say so.
Because
I mean,
I always struggle to
it's a,
address that issue with men.
It's the
Everyone
same
is
I mean,
way-
there's a cost factor. There's access to health for the general public. A lot of the people that are gonna seek fertility care generally go through the private. I mean, in government, we're still struggling with getting that service to our patients. Fertility therapy for
Yeah.
our
Sure.
patients.
But for those that can afford.
but
Yeah.
I think. Sorry. You can go.
Easy. Okay. No, I just wanted to add another problem I've noticed, especially with men, and when you start that discussion, they need an ejaculate, right? They need you to produce.
Yes.
Yeah.
Sure.
And I mean, asking a gent to go now jizz.
In the clinic.
Is it a problem?
In
though?
a debate.
Is it a
in
problem?
In a room for scientific purposes. It don't
I
work.
get that
be
complaint
tough.
a lot.
Yeah. So
Really?
I think not enough is also being invested in terms of actually getting men studied and getting
But how
guys
would you? I don't know. How do they get it? Just from the mind? Are they
Yes,
providing blue movies?
Yeah.
Then?
Yeah,
How
they
does it
do.
work?
I've
Yeah.
heard
Oh.
of people that have gone to give their sperm samples. They say they go there. There's a nurse, and she says, "Hey, look here. Do you want a
I mean-
magazine? Do you want
Yeah.
a
Guys, is it really that difficult?
No, I think maybe go to northern. Go to
Well, it depends. It depends.
Go to
on
know
the-
in-
I don't know if this happens in South Africa, but I know in other countries and more conservative, like in the Middle East and
Yeah.
stuff, you go there with your wife, and then
Yes.
you have
Oh, please.
intercourse, and just prior to ejaculation, then you
you put in-
because it's not really acceptable to
masturbate.
masturbation is not really acceptable in certain cultures and religions.
Yeah.
So that's the way that you get the sample. Yeah.
That's actually what I wanted to know. What I was gonna pose on you guys to find out that can you do this test at home? I'm sure it's allowed.
What
Where you
test?
take
I think the
timeline.
yeah.
the
the time
timeline.
is it? Oh, so you can't keep
Because
it.
the sperm will obviously liquefy at some point, and then it doesn't make it. It doesn't give a true reflection of what the actual quality
Oh,
of the
I
sample
see.
is.
So and
Okay.
you need cold storage immediately afterwards.
I would think so. To be
Yeah.
honest,
Not sure.
as far as
Yeah.
But
I'm
I've
not
seen a
entirely sure.
spermogram. They look at the time to liquefaction.
Yes.
Is
so
it?
There's a lot of
So-
factors.
so they get it immediately, and they also need to so the average is about 4 hours.
They need
Two-
to
two
see
to
how
4
how long it
Yes,
actually
yes.
takes to liquefy as
Okay.
well.
Okay.
Yeah.
So there's a bit of dynamics.
But look, when women think about their health, they think I need to go to Dr. Kofi and get an infertility check. Men should also start thinking like that.
100%.
You know?
Yeah, the way
We
I
should.
say pap smears should be done on the yearly. We should, but men are just too proud. Let's be honest.
That's the problem. Yeah.
if there's nothing wrong here, I'm not going. And for something to be wrong, I have to be struggling to get it up,
Yeah.
or
Yeah.
Yeah.
And you'll be surprised how many of them have low sperm counts.
Yeah.
How many men have
I
them?
think
So-
it's such a sensitive issue, especially for black men.
Mm.
I mean, the idea that there could be something wrong with
Impossible.
yeah.
Yes.
No.
Yeah.
Jeez,
It's
I
non-existent.
really
Yes.
struggle with
Impossible.
that one.
Yeah.
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 But what I find, normally helps, especially with my patients and whatever conditions I treat, is to also try and tell them stats before. I mean, sometimes you can pick up what this person is here for,
Sure.
but they're busy shooting left, right, left. Just to say that it's
okay.
It's okay. It's okay. 50% of the chance is actually Jets. Did you know that?
Yeah.
And then they feel more comfortable to say, okay, maybe he's seeing a lot of gents doing this, and instead of just saying, have you checked yourself? Then it's like it looks like
You're pointing fingers.
Yes, you're pointing fingers. and you think-
Estimating him as a man.
Exactly. Yeah.
100%. 100%.
Their masculinity
Yeah. So
is fragile.
tips, guys. What other tips do you give to your patients in terms of fertility, men
Have
and women?
sex.
Yeah.
Lots
have,
of it.
Have sex.
Lots of it. And what I think, sorry, just to cut in, is people want to have sex around ovulation. I find that's a problem.
Okay.
Because when you're ovulating as a woman, you're going to be like, okay, baby, it's time, eh? And the idea with sex is it's more pleasurable when it's spontaneous.
100%.
Right.
Yeah.
When it's planned and when it's time to the T, because now
Yes.
you have to come, and when you come, you have to perform now. You've probably had a hard day at work,
Yeah,
you're tired, you just
exactly.
want to come get. Now here's this woman telling you, listen, it's go time. Now that also speaks to the quality of the sperm you're going to produce. Let's be honest, because all of that stress and the day you've had, it does have an effect on the amount of ejaculate that you produce and the quality thereof. You know what I mean? So I tell my patients, look, if you want to fall pregnant, let's just make sure you're not on contraceptive. You've been off it for a long time. You're having intercourse at least 3 to 4 times per week, unprotected, obviously. And if you struggle in that time, come and see me. If you feel like you're worried,
Sure.
come and see me. You know what I mean?
Sure.
But this whole thing of, no, doc, we only want to have intercourse when it's day 14.
Yeah,
Because day 14, my eggs are good to go. No, the idea is sperm and eggs have a half-life. So you just need to make sure at any point in time, you've got some sperm
Sperms are around.
that are there. So whenever the intercourse happens, it happens.
Yeah.
Yeah. And you find people who are timing their intercourse, people who are on their checking ovulation, they do not fall pregnant. I see them. They come and they're like, doc, we're struggling. I'm like, so.
But do you give them a sex schedule? Because I know some people say that you need a sex schedule.
But that's the thing. I feel like sex should not be scheduled.
Yes.
especially if it's with your trusted somebody.
Yeah.
You know what I mean? But let's be honest, life does happen because, I mean, you've got kids, you've got this. But a woman who wants to fall pregnant, they will find
time.
They will find time and say, on this day, this
time.
But you, the man, you're usually less invested. Not that you're less invested, but it's hard for you to say, okay, on this day at this time, I'm going to have sex.
Yes.
Yeah.
You know, that's usually a woman's type of thing because women are more psychological and more emotional about sex. As far as a guy is concerned, it's just a matter of, okay, let's just have sex.
I'm telling you.
You know what I mean?
One position,
Anytime
one
is tea
move.
time.
One move.
You know what I mean?
You say something nice to me, it's showtime.
But for a woman, you have to literally warm her up from the minute you wake up in the morning. You have to send nice messages, send some flowers, so that by the time you get there at night, it's go time.
It's go time.
No, honestly, it's go time. You can't just wake up and be like, let's go. Because women are not those kind of creatures, or those kind of beings, sorry to say. They're not those kind of beings. They're emotional, they're more... men are physical, let's be honest.
Yeah.
Men is just about, I need to just offload my shot. I just need to let this load off. Sorry to say, but that's how it is.
Yeah.
Whereas a woman, it's about the whole process, wine and dine, foreplay.
Yes.
We
Exactly.
miss that as guys.
A
You know
lot
what I
of
mean?
foreplay.
We
Engage
miss
us,
that.
Dr. B.
Yeah.
Yes, Dr. B.
Yes,
Tell
Dr.
us,
B.
tell us.
But you need that
you
aspect.
have to marinate the meat before you.
An analogy.
Yeah. Marinating the meat. Sorry, guys.
That's the first time.
I know you asked about infertility. I had this question since the beginning. I need to ask Dr. Kofi and Dr. B this.
Yes.
So, in the gym, and I see, women tend to work just lower body.
Yeah.
Squats, all these dumbbell squats.
Yes, and
Doc, what does that have on pelvic strength and just male sexual satisfaction?
there's those
Does it-
machines in the gym that you never see men.
Never.
They're doing this
Those
with the
adapting
legs.
machines.
You don't see men there.
Pelvic floor exercises.
Yeah.
They call
Pelvic
them,
floor
right?
exercises.
Kegels.
Kegels even.
So
Yeah.
for men in the gym, if they see women doing those exercises, is it
Yeah.
more preferable to coitally to want to pursue?
That interest.
Yeah.
Do they have
Does
better
it
pelvic
improve on
strength?
fertility,
and-
pleasure? What does
Well,
it do?
look, it definitely helps with pleasure because remember when you have an orgasm as a woman, like it's multifactorial. It's muscles, it's hormones, it's blood supply. So obviously, the main job of muscles is to contract. And if you have strong muscles that contract during orgasm, the pleasure is heightened. There's more blood supply that goes to those muscles during orgasm.
Absolutely.
So the pleasure is through the roof compared to
Absolutely.
someone who
Grips D like this.
Yeah.
you know.
Absolutely.
Yes, it's exactly that.
That's exactly what it is.
So someone who is in the gym working on these muscles will definitely have better sexual experience compared to someone who hasn't. The same way we encourage women who've had normal vaginal deliveries to do their Kegels afterwards. Because the idea is after you've pushed out a baby, those muscles are weakened to a degree.
I see.
You understand? And then that's why the question people always ask, is it the same after a normal delivery? It depends. I mean, how are you doing your Kegels? Because
Dr. B, I hope you're big on Kegels and squats and
Doing them
pelvic
right
floor.
now.
Aibo.
That's the thing about Kegels. You don't necessarily need to go to the gym to do Kegels. Because it's the littlest things. You could go to the loo and literally do your Kegels. You you hold it, and then you wee again. That's literally you doing that Kegel exercise just to get those muscles working from time to time.
And men
More
can
than
do.
enough.
I'm doing Kegels right now.
But you should. Because we always,
It's
so
just
Doc,
that
you're saying
sensation
Kegels-
of stopping yourself from like the same feeling, when you get that when you need to pee
Yeah.
and you stop
Holding it.
yourself.
Okay.
That for a man even is a Kegel.
a Kegel.
That's
Okay.
how
It's a Kegel.
you
Is
can
it?
do a
Oh,
Kegel
okay.
as a man.
Okay.
And in fact, that's something that we often tell our patients who are suffering with premature ejaculation. If you do Kegel exercises, when it comes time for you actually to ejaculate, if you're strong enough with that, you can actually slow down your ejaculation by just doing a
back.
Kegel.
Yeah.
No wonder those guys in the gym who date gym girls, they look at us like peasants, man. Because clearly they are experiencing something
completely different.
completely that we don't know about. I understand those bras.
so remember, aside from sexual pleasure, if you do have good pelvic floor muscles, men and women, it just helps you in the long term as well.
Yeah.
Because over time we're all gonna have some degree of pelvic organ prolapse.
Okay.
Incontinence, and for women you get uterine prolapse and those kind of things. So if you do actually do these exercises, aside for sexual pleasure, it actually stands you in good health place.
Sure, that's good.
Yeah,
that's
excellent.
Good. Sorry, Swale. Then to go back to your serious question about fertility, you can go back.
No.
Okay, just on fertility. I mean, it's a serious topic. And sorry about interjecting with my silly question. But on fertility, I mean, we did mention the fact that most of the onus in terms of infertility is on the woman, or most of the time, whenever there's problems in a marriage, we tend to think it's the woman that's an issue. And I mean, I've seen some women even, getting to a really desperate state where they're now doing, following funny products like practices like yoni steaming.
100%.
What is yoni steaming?
What is that stuff?
Yoni pearls.
Yoni pearls. So that's this new art, if I can call it, where women expose their vaginas or their pelvic areas to steaming, and the idea is that the steam has certain chemicals and herbs that are meant to rejuvenate the vaginal or the pelvic organs.
So it's not fertility. It's
well, look, a lot of women have said that they get benefit from it as far as fertility, menstruation, endometriosis, fibroids is concerned. But
this is a traditional African.
Is this an African?
It initially started way back in the day as traditional African medication. It's just now it's been reinvented.
You've heard about this?
Yes.
You've tried it?
No, I have not. Okay. But having worked in the Eastern Cape, it is something that is practiced quite routinely.
Is it? What do they call it? Like in African?
Not the same name.
Is it? It's yoni.
I believe so.
Yoni.
Oh, yoni.
Yoni, probably.
Yoni.
Yeah.
What a lot of people don't realize is the emotional turmoil that a woman goes through who is trying to fall pregnant. And the relationship that she then has with her period, that I don't want to see this thing. You wait, you go through ovulation, you have sex, and then boom, you're bleeding. It's horrible. And one of the things that I appreciate as a family practitioner, general practitioner, is we get to sit down together and we break it down. Why are you feeling the way that you're feeling? How can I make it better for that 2-week wait? So that period between ovulation and day 28 of your cycle. What are some of the things that you can do to alleviate the pressure? Because we as doctors will say, just let it go. Just don't think about it. Don't
relax.
count.
Yes.
Relax.
Yes.
And the reality is that it's not that easy.
Harder to do.
It's very difficult. Your peers are falling pregnant. Your colleagues are falling pregnant. You go into the shopping mall. You see everyone is pregnant. It feels like you're the one with the problem. And I just want to say to all the ladies out there, you are not alone. It may feel like it's never going to happen, but get help as soon as possible. And it is doable. You're not alone. It's okay.
Start to Dr. B and Dr. B.
I will refer to Dr. Kofi.
100%.
So, Dr. Kofi, when your patients now tell you about yoni steaming, what do you say? I mean, medically.
Well, look, the idea is when you're trying to impart knowledge or information to a patient, you must always go from a scientific point of view, because it's easy to back that. And the truth is, yoni steaming has not been scientifically proven to actually make any difference to any of these conditions that it has been alluded to. So the idea is, as Dr. B mentioned, when a woman wants to fall pregnant, she wants to fall pregnant. So when she hears that there's this new thing on the market, you best believe she's going to try it.
Yeah. And are there any others that you've heard of and potential dangers?
Yoni is the biggest one.
Castor oil. I'm having a lot of ladies padding their pads with castor oil, or dipping
the laxative.
Dipping the tampons in castor oil. They come in. One lady actually forgot the tampon inside. It was a mess. Another thing that women are now doing is combining contraceptives with something like Clomid. So there's a lot of desperation out there.
Clomid is a
ovulation induction agent.
Yeah, ovulation
so
induction.
It just stimulates women who are not ovulating to actually ovulate, and then increase chances of actually conceiving. Obviously, it should be given as per prescription. It's not the kind of thing that you get over the counter. After you've been examined and you see that a patient meets the criteria, then you would prescribe something like Clomid for a patient.
So this is very concerning, and I just broadly thinking, what is driving women to these type of things?
TikTok.
You
So
know?
I hear a lot of women saying, I saw this on
taken
TikTok,
over.
and a lot of women have said they've fallen pregnant on it. I've tried it to shrink my fibroids,
Yes.
and I'm
Just
hoping it'll work.
As men as well, we also play a part.
Pressure.
Women might not have children, meets a new husband, he has children from another woman.
Yeah.
Now he's pressurizing her to have children. So gents, let's also play our part, man, and not put pressure on the ladies, because we actually don't understand what they're going through and the things they're going through are doing to try and satisfy us.
That's,
Exactly.
So let's be aware of that, man.
Yeah. 100%.
Yeah, look, I think in closing, I know we don't have much time, but I think kind of just to close the whole conversation about fertility, women's health. Dr. Kofi, we know you've written two lovely books.
Yes.
Quickly tell us about the inspiration behind the books, what to expect when reading these books, and what we hope to learn from these books that you've written.
Okay. So the company that I've started with my private practice is GynaeWorx, and I've based it on, it's centered primarily around patient information, because I feel like the more patients know, the easier my job is. And especially with the first book that was released in 2021, it's pregnancy related. That's basically an obstetric based book. So that's a book that basically journeys with a woman throughout pregnancy. So how this actually came about is that, with obstetrics, you have lots of late nights. So you'll be sitting, the minute they call you, there it is. So in obstetrics, the minute you get called by the labor ward, you best believe your night is gone.
Yeah.
Because they're calling you every 30 minutes to an hour to 2 hours. You are literally not going to get any rest. So this is something that starts already when you're in state as a registrar. So your body is used to this. Your body is used to a lifestyle of no sleep, basically, right? So in private, you come there, you find, okay, now there's a patient. You're at home, mind you, when the patient's there. Obviously, they'll call you as and when they need you. And my thing was, okay, I want to do something that actually grows my practice, but also helps to inform patients. So how this actually started was, I started writing little leaflets to say when a patient comes in, I give them this little pamphlet if they're pregnant, and this is going to explain to them what to expect as far as the pregnancy journey is concerned. Just so happens there was a lot that women needed to know, hey? And that actually
So it was a book.
It resulted in a book. So that is the first book that's pregnancy related. That is available on our website, www.gynaeworx.co.za, to place an order, and you can get one of those. And then that is pregnancy. I mean, pregnancy is my passion. I'll be honest. I mean, I love obstetrics and gynecology, but I feel like obstetrics is more my thing. But I felt like there needed to be a follow-up to this that tailors to the women that do not necessarily want to fall pregnant. Not all women want to fall pregnant, but they might have questions about women's health. And the common question you get is this normal? That's what a majority of women want to know. Is this normal? My period is going on for 7 days. Is this normal? I have lots of pain when I'm on my period. Is this normal? I have the side effect from my contraceptive. Is this normal? So basically, the next book that I wrote, which was released last year, is The Do's and Don'ts of Women's Health. So that basically is what the title says. It basically goes into all the aspects of women's health and what is scientifically proven as a do and what is also scientifically proven as a don't, just so that women can take care of themselves without necessarily always having to go to a gynae. Because let's be honest, we're not cheap as gynaes. We're not
Yes.
Definitely.
And I feel like, there's a lot of misinformation out there. You Google anything you want on the internet, you'll find what you're looking for. Good, bad, whatever it is, you'll find what you're looking for, and it may not necessarily be the right information for you. So I feel like this book was a step in that direction to try and kind of close that gap that exists between us as doctors and patients that we may not necessarily get to see or consult. That if you get a hold of the book, you'll know that, okay, at least this is coming from someone that is qualified and it's evidence-based, and therefore I'm in a good place, So that's the second book that was released last year, The Do's and Don'ts of Women's Health.
Amazing stuff.
That is
Awesome.
Amazing stuff. Yeah.
Thank you.
Amazing stuff. We had one final question, and I think we can end it off on a slightly lighter note. We had discussed this on a previous podcast, but
couldn't reach a consensus.
we couldn't reach a consensus.
Okay.
So, upon female ejaculation,
Right.
certain women have this ejaculate, or the colloquial term the people on the street use is squirting. Now, we wanted to know, from the two of you what you think that substance actually is. Is it urine because they lose bladder continence at that point? Or is it actual ejaculate? What is the consensus we need to come to today?
To know.
Before we leave, we need to know. The people want to know.
The people want to know.
Dr. B, do you have any?
It takes in this one.
You're the lady. We've got to ask you first.
Kofi?
Yo, she's throwing it away.
Already, you're not even going to take a stab in the dark.
Nope.
Okay.
Well, look. There are certain secretions that are produced during intercourse, particularly with orgasm, as far as women are concerned. There's the natural ones that we get, and squirting is a recognized action. It does happen, right? In certain women, it does. And
how? What happens?
So remember, there's a lot of like we spoke to about the pelvic floor muscles. There's a lot of contractility that happens. So the pelvic floor muscle eventually actually supports the muscles, the organs in the pelvic region. So we're talking the uterus and the bladder primarily. So the idea is when you're having an orgasm, what's happening? These muscles are essentially contracting under the influence of hormones and all the blood supply as well. So some women, as a result of that, they can lose control in terms of the bladder.
Okay.
But you do also get what you call sexual incontinence. So that's incontinence when a woman is penetrated that is not necessarily occurring at orgasm, but rather just by virtue of there being a sexual act.
Okay.
They lose control of their bladder. So that is actually a recognized term as well. But as far as the squirting is concerned, it's more associated with orgasm and the contractility of all the pelvic floor muscles that happen that can sometimes cause that squirting as we've described it. That in theory is actually a combination of urine and some of this the fluid from the woman having the orgasm. So it's a combination.
The glands.
So you've got the Bartholin's glands and you've got the gland, the skin gland.
Oh yes.
So those are the ones that produce the secretions that I'm talking about. So part of it is from the secretions that would obviously be through the vagina, and part of it would be through the urethra, which is the opening of the actual bladder. So it's a combination. That's actually what we.
Final.
Dr. B, no additions?
No, I've got a question
Okay. All right. Okay.
She ran away from that one. I think this one is important for men to understand.
Yeah.
Is a man being able to make you squirt a sort of accomplishment? Or is it something that women look for and say, yo, that man made me squirt, I'm going to go back. He's more alpha than the one who didn't make me squirt.
He does his Kegels.
Yeah.
No.
So is that some, because men have this, this presumption that, yo, I made this girl squirt. I've never done that. You're weak.
No, I think for most, well, not for most women, but a woman's orgasm predominantly lies with her. She determines if she's going to orgasm or not.
Amandla.
A lot of the time, it's in the mind. You need to relax. It's like swimming. Once you relax, you let go. No body issues. You're in the moment. You're with your partner. It's very intimate. You will arrive at your destination. It cannot be about the other person.
Okay.
It absolutely cannot be. You can change positions. You can do whatever it is that it takes for you to orgasm. But I think it's a little bit unfair to put it on your partner.
Okay.
It's men
So
who put
gents,
it on
you're fine.
themselves.
Gents are fine.
No, gents are fine. 2 centimeters. You're doing very well. Any issues, it's in your head. It's all in your head.
It's all in your head.
Look, there are tricks and things that a guy can do to make the experience a little bit better. But predominantly,
ladies, just relax.
Just relax. Just
putting a lot of
just swim.
stress on us men. And it's giving us a lot of business, so keep doing it. But I think that definitely brings us to a close for today's episode. And thank you guys so much, Dr. B Sumbulo, for joining us, and Dr. Kofi Kwa-Asante. We've had a really good time chatting fertility,
and great
women's reproductive health, and we had our first female guest who is also a doctor to share all her perspectives. I think it's been great. Tune in again next month for another episode of the Gents Clinic podcast. My name is Dr. Soil Essa.
Dr. Kofi Kwa-Asante.
Dr. Ntanta Vilakazi. And just to correct that, we've actually had a female Sangoma on the show.
Oh, yes.
Oaks.
Oh, yes, we did.
Dr. Ntanta Vilakazi.
Oaks. Dr. B from the Healthcare Hive.
Dr. Brendan Matthews.
Gents Clinic Podcast, episode 8.